We're now in the formal procurement stage to select an electronic patient record. During this stage, we'll describe our requirements and request that capable suppliers demonstrate their systems and provide a commercial proposal to evidence how they will meet our needs. Introducing an electronic patient record will transform our entire way of working, getting the right care to the right people at the right time. The implementation of an EPR is a very complex organisational change and will impact a lot of, if not all of the service lines within a trust of our size. So we have to make sure that all of our people feel supported on the journey.
This is something that we have to do with staff, not do to staff. We have a team, a representative team from across the trust helping us with that commercial choice. But at the point we have the preferred supplier, we are going to be going to staff groups and we're going to have 18 months of very hard work to understand how people work today, to very carefully process map how people are working today, and then to take those clinical pathways and try and transform them on top of the IT possibility that we've got. So this is something that we have to do with people over the course of about 18 months before we go live.
It's going to be hugely different, and I think people are going to need to work at their own time, so they're going to need this time and space to get their head around it, to be able to vision what their services will look like in the future, because at the moment, if I take my experience from the last organisation I worked in, I couldn't picture what my service would look like within an electronic patient record moving away from paper. So people are going to need time, they're going to need space, and they're going to need lots of support. But that's all going to be made available to them in order to be able to really help us move forward.
This is definitely not something that is done to us. It has to be something that we do together. So we as clinicians and managers, administrative staff, nursing, everyone needs to be part of the process. It can't be something that we just receive and use. We have to work with all the teams, understand how they do their job currently, and understand how we translate that into a new system that will still continue to make them work and perhaps even, ideally, make them work more effectively and safer.
So one of the big advantages at the moment for our staff is the digital care site that we've launched within the organisation. It's a wealth of information about digital, it's a wealth of information about what currently is happening, and I think that's vital because even us, we don't know all the answers yet, and it's changing rapidly all the time, and things are happening and things are coming, and I want to get that across, that things will be coming, because I think often we feel nothing's happening and nothing's actually, no progress is being made. But I promise you there are lots of things happening in the background to make this real for you, and if you want further information, the digital care site is the best place to go and find that information out.